So, good morning all.
Good morning, Ajmal.
So, we have Durga, Dharani, Joyce, Subha. Good morning everyone. So, my name is Christy.
My name is Harsha.
So, we are today here with another amazing episode of our OET writing module. So, I think you're excited, right, Harsha?
Yeah, so much.
Yeah. So, I can see some more people are joining. Today in AJINORAH, these days we all are having a amazing happiness and a fabulous days because in AJINORAH every day is amazing, but still these days means we are expanding our wings, like we have opened our new branch at New Zealand, and these days we have gotten amazing fabulous results of our OET January 28 exam. So with all those things, we are having a very good time here, and we hope you guys are doing very well too. So I think Alfie, good morning. Alfie, good morning. Yeah, I can see some of you commenting here. So well, if we move further, we can see before going to our session, as you know, today's session will be our writing module, but still before going further, we would like to give you some more informations regarding our what we have upcoming for you these days. So would you like to tell that?
Yeah, we have a German direct interview which is held on 18th of this month.
Yeah.
And what else we got, Christy?
Yeah, the thing is that, like she said, German client interview will be held on Calicut on this Saturday. So please mark your date on the calendar. It's a direct client interview, so you can it will be very easy for you to go to German very fastly if you attend it. So it will be on Calicut, please mark it. And one more thing is that we, like I said earlier, we have got lots and lots of new newses and new upcoming updates, like what is going on right now, but please stay tuned on our channels and on our pages to know more about that. Okay, so I think we can go to a session now, am I right?
Yeah, sure, we can proceed with that.
Yeah. So Harsha, what we have got today?
We are just going to see regarding how to write an effective letter to a GP.
Yes, that's right. We are going to know more regarding how to letter. See, I think, Harsha, don't you think that all our students know how to write a letter?
Yeah, sure, because that is a basic thing that every OET student knows.
Yeah, but still, what do we have special today then?
Because we are going to see regarding an unknown case and also about a known case.
Yeah, I think she has already given you a big clue right now. So we are going to discuss regarding how to construct a letter to a GP with a known case and with an unknown case also. So I know that you guys already have a clear picture regarding those things, but see, if I am telling means it's completely with my idea and my knowledge, but as you know, we are a big community, and if we spread our knowledge and if we ask our concerns and queries, it will help others also to improve their knowledge. So I think you can ask your doubts and you can ask any of your concerns today. So I think, shall we move with that?
Yeah, sure.
Yeah, okay. So here we have our slide, like as you know, we are doing an effective referral letter to GP. See, today we are going to do about 2 cases, okay? Not only 1 letter, we are going to discuss regarding 2 letters. I think it's a bonus for them, am I right?
Yeah.
Exactly. But still, Harsha, what do you think? What type of cases it will be? As you said, it's a known case and unknown case. So do you want to give any brief idea to them regarding those?
Yeah, sure. Firstly, let us see regarding what we got here for our first case letter.
Yeah. So
our today's first case note is regarding a patient called Miss Cassandra Kinser, and she is 32 years old, and she is admitted in the medical ward where we are working as a registered nurse. And we have got all the patient details here. The patient's name is Cassandra Kinser, and her marital status is single, and she's from Cabramatta, and her admission date and discharge date is given, that is 17th of January 2018. And when she was admitted to our hospital, we got some information regarding she had a lip laceration, which was alleged assault by boyfriend, or not. She was not seeking any medical care for that, and also she was having abdominal pain and burning sensation while urination, and also she may have some STD too. So we are now suspecting for any sexually transmitted disease in case of Cassandra Kinser. And she is having vomiting and diarrhea, but she denies those symptoms, and she is a person who is sexually active and does not use any kind of protection.
Yeah.
And about her social background, she is a smoker, and she consumes a little bit of alcohol, and also she denies the use of illicit drugs.
Okay.
And about her past medical history, she has a history of schizophrenia.
Yeah.
And about her current diagnosis, she has an infected lip laceration and also urinary tract infection, and is suspected to have a sexually transmitted disease. And about her cardiovascular
I think
system.
that's what the things are normal there, right?
Yeah,
It's showing
everything
it's
is
negative
normal.
and she is denying it. So can we go to the next slide?
Yeah.
Yeah.
And here we can see about the nursing management or the treatment which was provided for Miss Kinser. And for her lip, they were provided with the ciprofloxacin of 500 mg orally twice a day, which was given for almost 6 days.
Okay.
And clindamycin 300 mg orally 4 times daily, and it was given for almost 10 days. And Peridox mouthwash 10 ml for her oral hygiene and all, and oxycodone once orally every 4 hours. Yeah, for now we are writing a letter to GP for her case of urinary tract infection. And next is about our discharge plan, and we have made an appointment with the sexual health clinic, and also we are asking our GP to follow up results and for also monitoring the antibiotics and also to provide a treatment for her UTI.
Yeah.
And
here comes the very interesting part. Here we will get a big knowledge, complete knowledge regarding why we are lighting, to whom we are lighting, what is the purpose, and everything we'll get from here. Okay,
so writing task for this case note is, using this information given in the case note, write a referral letter to Miss Kinser's general practitioner, Dr. Travis Wren, at Punt Road Medical Clinic, 172 Punt Road, Mostman 2088, for further medical evaluation and treatment.
yeah, very good. So, Harsha, what do you think? What kind of case is this?
Maybe we'll be writing a letter to a local GP, right?
No, Harsha. Don't you think it's a non-case?
Yeah, of course it is a non-case.
I think you saw it right now, right? It's okay. So we have that here that it's a non-case. Why I have said that it's a non-case? So one more thing, if you have got ideas regarding what we are telling, you can just simply put it in the comment section. We'll be reading that. Okay. So today we have this as a non-case. Okay. Why? Because here it's clearly given that it's Miss Kinser's GP.
General practitioner.
So obviously it will be a non-case. So what do you think? At what circumstances we can say that it's a non-case? What do you think?
Because already the medical history of that patient will be known to that general practitioner, because about her past history and everything will be known to that specific general practitioner.
Yeah. What she said is, I completely agree with that. So how do we know it's a non-case? So my question is that how do we know it's a non-case? So here we can see it's clearly given Miss Kinser's general practitioner. So obviously it's a non-case. In other cases, what it can be, patients on GP or patients, sometimes family GPs can or may not be some non-cases. It depends upon the case. So most of the times if you're writing to a GP, these all can be the criterias. Or if you're writing to a nurse and all, obviously their addresses, both addresses will be the same, or patient will be going back to the care home that he came from. All those things, it can be a non-case. So I hope you guys got an idea regarding how to find a non-case or unknown case. So I already can see some of them commenting that it's a non-case. I really appreciate that. So thank you everyone for commenting those. You can ask your concerns and also you can comment it. Now Harsha, would you like to take the relevant and irrelevant data in this?
Yeah, sure.
Yeah, over to Harsha. Yeah, please. Thank you.
Okay, here about the patient's name, it is really needed, and also about her marital status, I think it is not needed, right? And about her residence, not at all relevant. And next of kin, not at all relevant. And we can say because it is needed that about her admission details, right? So date is needed. And about her diagnosis and all, we can say about her infected lip laceration, so it is relevant for that, and also her abdominal pain and her burning sensation about while she is passing urine, and it is also really needed. And she is suspected to have sexually transmitted disease, and so we can say this is really relevant. And the patient is still denying some of the symptoms that the patient is experiencing, so all these are really needed. And also we can say about whether the patient is sexually active and she's not using any kind of protection, so there is a higher chance for her to acquiring
STD,
sexually transmitted disease, right? So it is really needed,
relevant.
And about her social background, I don't think it is really needed for her. So
but why?
Because in our case, I don't think it is really relevant.
Maybe because of the non-case, am I right?
Yeah, right. So I think smoker, about her habit, it is not at all needed. About her alcoholism, also it is approximately, I mean, it is absolutely irrelevant. And about her social habit, it is also irrelevant. And maybe even though the GP is having a knowledge regarding her schizophrenia, it will be better if you are just mentioning about her schizophrenia, right?
Yeah,
so
you're right.
It is relevant. And we can say about her infected lip laceration, as I have mentioned earlier, and also about her urinary tract infection, and also she is suspected to have sexually transmitted disease. And as we have mentioned, and also from our previous discussion, we told that all other her assessment details are showing normal details, right? So I don't think it is really necessary, right? So all these things are really...
Oh, we can simply say it in one line, like she denies all her symptoms. That's better, I think so.
So all these informations are really irrelevant.
Or we can consider it as a semi-relevant also if you want, but don't expand all those ideas. It will make your letter in a more unconcised way, okay?
Okay. Next one is about a nursing management. As we know, it is really necessary for the GP to know about her current health status, also the current treatment measures that we have given. So all these treatment measures which were provided for Miss Cancer is really necessary. So we can say this nursing management is fully relevant.
Of course.
And also we are writing this letter we have taken an appointment with the sexual health clinic, so we can mention that thing to general practitioner, and also it is relevant. And also we are writing this letter to the GP in order to get the follow-up results, and also for monitoring her antibiotic, and also for treating her urinary tract infection. So it is relevant.
So all these things we have got here. Now shall I give a complete or outline regarding her case?
Yeah, sure.
Thank you. Well, here what we have got a patient named Cassandra Kinser. She is a 32-year-old female. Okay. Now what she has got some burning sensation while urinating. So that's the reason why she came to the hospital. After she came to the hospital, we have seen that her lips has got lacerated, and we think that she is it's not saying that she said or not, but the brackets it's given that what it's said to be alleged by her assault by her boyfriend. Okay, so she didn't seek any medical care, so obviously it's alleged assault by boyfriend. So we know it is something that her boyfriend has done, so we can simply add it into the letter there. And she has abdominal pain, and she has burning with urination last several days. All these things she has came now, and after our initial assessment, we think that she may have STD. Okay, because we have seen some lip lacerations and some urinary infections. Obviously, we all are nurses. We know what are some initial signs and symptoms of STDs. So we suspect that. And now we are writing this letter to her GP to treat UTI, to treat her UTI. But at the same time, we are telling GP that she may or may not have STD. Okay, so you can clearly see here that STD is a suspected case. So what I suggest is, Harsha, well, before that, do you think that we need to tell this STD thing in the intro para?
Because I don't think that, because we can't mention about the diagnosis, right, as we are nurse. So we can tell about the infected lip laceration or about the urinary tract infection. Is that right?
Yeah, exactly. Thank you. Well, thank you for that. Now, where I was is, she may or may not have STD. That's the thing. Now, we are writing this letter to a GP regarding her social history. She is a chain smoker. See, she's a chain smoker, and we are writing this letter to a non-GP. Obviously, the doctor will be knowing that. So, I don't think that's so much relevant to tell that. And she is she consumes alcohol, and there's one more thing in the social history. She denies illicit drugs. So, I don't think all these are that much relevant to tell that to her non-GP. Now, regarding the past medical history. So, as you know, while we are writing a known case, we can write the body para. We can start the body para with as you know or as you may know, because it's not clearly given that the GP knows that. Okay, but still it's given that it's a known case, right?
Yeah.
So we can start with as you know or as you may know. That's completely fine. Okay, now that's regarding the history of schizophrenia. Now, regarding her illness, she is denying all her symptoms and all the things what the medical team is telling her. So this is an all outline regarding her condition. I hope you got it. And one more thing is that we have already provided some medicines regarding her conditions, for her conditions. Okay, so as it's not that much medicines, we can simply mention that. And also one more thing, that medicine is still ongoing, it's not outdated, it's that is currently being prescribed. So I think it's very important to tell those medicines in our letter.
Yeah.
So
I think, Christy, here we got a doubt from Arjun Shekhar and also from Sharon John.
Yeah.
Do we need to mention about schizophrenia, because GP already knows about his condition?
Exactly, that's what I just said. So I obviously know you guys will be having doubt in that. Anyway, like I said, schizophrenia is a condition which was there, and maybe or may not be, GP knows it. Okay, so that's why we are while coming to the letter, you will understand how we have concised or how we have said it. Then you will understand it. Okay, so I think we can tell that while explaining the letter. Is that right?
Yeah.
Thank you. So Arjun and Sharon, please stay tuned. Okay, please be there. We'll be clearing that out. Okay. So shall we move to the letter?
Yeah, sure.
Yeah, very excited, no?
Yeah, really.
Yeah. Okay, so shall we have the slide there? Yes, it's a Cassandra Kinser. As you all know, today's date is 17 January 2018. So the admission date and the discharge date is the same here. So today's date will be the discharge date, that is 17 January 2018. Now the address.
Here we got the address. The recipient's name is Dr. Travis Wren, Punt Road Medical Clinic, 172 Punt Road, Mosman, 2-0-88.
Yes, I just want to tell, I'm interrupting you, I know that, but still I just want to tell a simple thing there. See, we have written this 2088 in this line, right?
Yeah.
But in the address para, if you go to the address para, can you please go to the address para now?
Yeah, sure.
In the case note. Yeah. If you see here, we have got Mosman, 2088 here.
Yeah.
So why don't we write in the next para or in the next line? Now, please go to the answer. Why don't we write in the next line there?
Because either we can write in the next line or
Yes.
also.
What she said is completely right. We can write. The thing is that it's not appropriate. It's not appropriate to write a 4-digit number on the next line alone. It should be written along with a address before or after. That's why we have written like that. Okay. I know you guys will be asking those doubts. Now here one more thing the students are keep asking is whether we need to put a comma after that Mosman. So there is no need for any comma, just leave a space and write that number. I hope you got it right.
Yeah.
So here we have got the doctor's name, so we have written what?
The address.
Yeah, dear Dr. Ren. The salutation we have written dear Dr. Ren. Now the reference
Miss Cassandra Kinser, and she is aged 32.
only that much is needed. Okay, so we can simply write our address para. I hope there is no doubts in the address para. If there is no doubts, if you have any doubts in this address para, you can ask now, or we are moving to the next intro paras. Can you see any doubts there?
No.
So shall we move to the next para?
Okay, sure.
Very good. So here we have our first intro para. Here, Miss Cassandra Kinser, comma, a patient of yours, comma, requires further medical evaluation and ongoing treatment. She is suspected to be assaulted by her boyfriend and has a urinary tract infection. So, why we have started with a patient of yours?
Because already GP knows about her, right?
Yes, exactly. Now you will be asking like whether we need to tell the patient here, we need to write the patient or yours here. It's a known case, okay? So we can write that. We need to tell them that we need to make him remind that she is your patient. So that's why we are writing like that. There is no objection in that. So Miss Cassandra Kinser, a patient of yours. So we haven't used who requires, right?
Yeah.
Because we have started with her name. Okay, so that's why we haven't used who requires. It doesn't sound good, and as we have started with the name, it obviously goes to her. So we can simply write it like requires further medical evaluation and ongoing treatment. She is suspected to be assaulted by her boyfriend and has urinary tract infection. Now see, I can see in the comment section that we can write she is suspected to have STD. Princey, yeah, Princey. The thing is that while we are writing about STD here, we are suspecting only, and we have a confirmed thing in our hand with her. So obviously we can simply write about her UTI, and also her boyfriend thing is also something that we can write there. I think that is completely okay upon that. She is suspected to be assaulted by her boyfriend and has urinary tract infection. Those things are confirmed. So we can write that at the first, and the STD thing you will see how we have written it. So you can understand how it goes. So here I hope you don't have any doubts. It's confirmed that she has urinary tract infection. That's why we have written like that. And she is alleged to be assaulted by her boyfriend. That's why we have framed a sentence like this. I think it's okay, no?
Yeah, it's really clear now.
So can we go to the next? Okay, so what do you think? What should be the next body para?
Maybe about her current health status, or because of what she was admitted, and what are the treatment that we have provided.
Exactly. So you are telling that it should be a present, no?
Yeah, really.
Yeah, I have the same opinion, because as it's a non-case, I think that we need to tell regarding why we are writing a letter about her to her own GP. So we need to tell the GP regarding her present condition right now. Am I right?
Yeah.
Okay. So in this, here we can see a detailed explanation regarding her. So as you know, we have as you can see, we have this first body para. Miss Kinser was admitted to hospital today with infected lip laceration. So you will be asking doubt why we have not mentioned date, ma'am. You will be asking doubt like that. So see, Miss Kinser was admitted to hospital today. Here we have mentioned that today. What is the date today? 17 January. And what is the discharge date? 17 January. She was already admitted on 17 January. So there is, I don't think that there is no need of writing all these things repeated and repeated again. We can simply write a word there. Is that right?
Yeah, sure.
Yeah.
We can reduce the words, right?
Exactly. Miss Kinser was admitted to hospital today with infected lip laceration. Obviously, she was admitted, and we have seen that she has got infected lip lacerations. So that's why we have written like that. Now, she has had abdominal pain and burning sensation while urination for several days. So we have used the word
Has had.
So what we need to use?
So along with that, we need to mention about the duration.
Exactly, the time frame. So now you'll be asking, we haven't used the since. No, it's not like that, okay? We can use for or since, both to both to mention the time frame. Okay, so here we have used for several days. So that's a time period. No?
Yeah.
Is it really necessary to tell the 2 days or a 3 days or a 3-year time period?
No.
We can simply write like this, right? Yeah. So she has had abdominal pain and burning sensation. We have said her symptoms regarding how she came here. Burning sensation while urination for several days. Okay. Now we have mentioned she has been
Commenced on ciprofloxacin 500 mg twice daily for 6 days.
okay.
And also clindamycin 300 mg 4 times daily for 10 days.
Okay. So Harsha, what do you think? Why we haven't said all the medicines in just one line?
Maybe because she. What can be the reason?
Yeah. I think we can construct it in a more nice way, no?
Yeah.
If we are writing like this, so what do you think? We can simply write like, yes, we can write all the medicines things together. We can write she has been commenced on ciprofloxacin, clindamycin, peridox and oxycodone, everything we can write together. There is no problem in that. But I want to make my letter in a more beautiful way.
Oh, okay.
Yeah. So that's why I have used more phrases, more templates there. I have used connective there. So I want to fill my letter with all these things. That's why I have used like this.
Okay.
As you know, it's a non-case. Okay. Yeah. So there can be a chance that if we really concise the letter, it will make the word count really low. So it will be better if you can use more words within that word count, but still in a more nice way, like we have made here. Okay. So she has been commenced on all those medicines, and I have made a full stop there. And in addition, she has been instructed to use the mouthwash. So after the meals and before bed. And about the oxycodone also we have clearly said that.
Yes.
Okay. So I hope you don't have any doubts here. No. I can see a doubt regarding Arya C. So can we write 2 diagnoses in purpose para? So Arya, see. She is assaulted by her boyfriend. Actually, that's not a diagnosis. Okay, that's her state or that's her situation that we have mentioned in the body para, and we have mentioned her UTI also. No problem in that. And in the regarding diagnosis, obviously we can, if the patient has got 2 diagnoses to confirm the diagnosis, then there is no problem in telling that. Do you think like that?
Yeah, it's absolutely right. If the confirmed diagnosis is given, we can go for that. Otherwise, it is better to write like this.
Yeah, correct. So I have got one more doubt. Jomon, is it possible to write on inter paragraph updating the current health status of Miss Kinser who requires? Of course, Jomon, it's very it's completely okay to write like that. It's like, can you please go to the previous slide? Yeah. We can simply start like, I'm writing to update you regarding the current health status of Miss Cassandra Kinser, who requires further medical evaluation and ongoing treatment. Here I have used word who requires because I have started in another way. That's why. So and rest of the same things will be completely like what we have listed here. Okay. Yeah.
Now, Christy, here we got a doubt from Belina. Whether can we write presented with complaints of?
Yeah, we can write. We can write like here we have said like Miss Kinser was admitted. If you are using presented, we can write like Miss Kinser presented with the complaint of. Now here I think we don't have a date or a time period till from which day she was having those. If we were given a 5 days, she was having all the symptoms from the last 5 days, we can write like Miss Kinser presented with a 5-day history of. Anyway, I think we are going to tell that in the next.
An example for that.
Yeah, we'll give you that example. What was the name? Belina, please stay tuned. We'll be giving a complete example regarding that. Okay. Anyway, I think your doubt is cleared.
Yeah.
Okay, Anne has asked, is it okay to use ongoing treatment? Of course, Anne, it's completely okay to use ongoing treatment. If the patient requires ongoing treatment, then it's okay. Here, the patient needs a further care and she needs ongoing treatment for her condition, so we can use that for that. Okay. So, next one, Tiaga has asked if whether we need to write like ciprofloxacin, 500 mg. So, listen, we can write the medicine names in two different ways. Okay, if I want here, I can put a comma after the ciprofloxacin 500 mg, like a comma here, then I can write like that. But as we know, we will be very panicked and we will be very stressed during our OET exams.
Sure.
So, do you think whether we will get an idea at the proofreading?
We will be really confused what to do next, and we will be in a critical situation.
Yeah.
So we'll forget to put a comma there.
Exactly, and we'll obviously forget to put a comma there, and if we put a comma on the next, obviously it will be some mismatches there. So it's always better to keep your letter clean. So what I suggest to my students is like if you can simply write the this medicine without any commas or anything, like how we have this comma is not here. Okay, how we have listed here, it will be great. Okay, now can we move to the next?
Yeah, sure.
Okay, now next, in the next body para, we have got what?
About patient's past history and all.
And also the social history, right?
Social history, yeah.
Okay, but Harsha, what do you think? Why do we need to mention the social history to her own GP?
Because patient may, the GP may or may not be knowing regarding that.
Exactly, Harsha. So that's why we have used what?
About schizophrenia?
Yes, as you may know. Okay, that's why we have mentioned as you may know here. So, as you may know, Miss Kinzer has a history of schizophrenia and she lives a solitary life. Obviously, you will be asking here now why we need to mention schizophrenia and solitary life and all, because we need to mention that in both with two reasons, because otherwise our letter content will be really low. Our word count will be less, so we need to avoid that, and we are mentioning that like as you may know, because it's not given that he knows or he not knows. Okay, so it's always safe to use like that. Do you think like that?
Yeah, that's absolutely right.
Thank you. So as you may know, Miss Kinzer has a history of schizophrenia and she lives a solitary life. I think that's clear till there. Now, she is sexually active and does not use any protection. Is that really necessary?
Yeah, as we have discussed earlier, maybe the GP will not be knowing regarding that, and also in this case, Ms. Kinzer is really suspected to have sexually transmitted disease. So I think it is really necessary to mention about that.
Exactly. I was about to give the same explanation. So she is sexually active and does not use any protection. So she is at high risk of what? For getting a sexually transmitted disease. Okay, and we know that she has already got an appointment. We have already got an appointment at the sexual health clinic. So we need to connect those things. That's why we are mentioning these things here. So we are connecting all those three datas, like she is suspected, active. She is sexually active, she does not use any protection, she has an appointment. All those three datas into this, and that is completely fine. There is no problem in that. Okay. Now, therefore, she is suspected to have a STD, and an appointment has been arranged at sexual health clinic. Okay. Now, please note, she is, I think that S can be small. Okay. Please note, she is reluctant to take treatment and denies certain symptoms from the medical team. Okay. So, I think see Harsha, when we have got this line, the last line, that is complete, that's not that much connecting with the above lines, no?
Yeah.
But we have connected it using please note. Okay, so when you have got something like that, you can connect it with like a please note. There is no problem in that. So you'll be asking, we'll be only allowed to use the please note in the recommendation, but it's not like that. Okay. we can use those things if that is a completely relevant thing and that needs to be noted, but that is not able to connect with those above things. We can use this please note or a kindly note. There is no problem in that. Okay, so please note she is reluctant to take treatment and denies certain symptoms from the medical team. So here during your case note explanation we have said that she is denying some certain symptoms, no? So at that time itself I have said that there is no need to write all those, as she is also already denying and some of the symptoms are exactly negative. So we know never, it's not that much needed to mention all those symptoms particularly or specifically to our letter. So we can simply
make it in a concise manner.
Exactly. So I think it's a good one, no?
Yeah.
What
really.
do you think?
Yeah,
thank you. So she is reluctant to treatment and denies certain symptoms from the medical team. I think it's clear. Shall we move to the next slide? Before moving, what do we have got next?
We got about the recommendation.
So is there anything left to write in our board, in our letter?
About her evaluation or about her antibiotics and about her UTI.
Yes.
About her.
So we can mention those things in our recommendation para. Am I right?
Yeah.
So shall we move?
Yeah.
Yes. Proceed. Why don't you tell to our students how it goes?
Okay, our recommendation paragraphs is like, your expert guidance and support in this regard would be beneficial for Ms. Kenser's speedy recovery. Please monitor her antibiotics as well as progress of her condition.
Yes. So I know most of our students will be no, not us, most of the students will be writing like, it would be appreciated if you could provide further care and support to Ms. Kinser, right?
Yeah.
So I have used a different thing here. Is that okay?
Yeah, it's really
do
wonderful.
It like do you think like it's beautiful?
Yeah, of course.
Okay, so your expert guidance and support in this regard would be beneficial for Miss Kinser's speedy recovery. So if you are writing a letter to a GP, you can start like this: your expert advice, your expert guidance, your expert consultation or your expert assessment would be beneficial. Like that we can write in the recommendation para. Okay, that's completely fine. Now here the doctor needs to provide some guidance and the support. As we know, she is denying. Yeah, and one more thing is that please monitor her antibiotic as well as progress of her condition. As we have mentioned, as we have seen in the case note, we can see that she is denying some symptoms and obviously she will be denying some treatments. So we need to tell the GP that he need to provide some guidance and support to her to get a speedy recovery for her. Now please monitor her antibiotics as well as progress of her condition. So the antibiotics needs to be monitored, so that's why we are telling like that. Now we are ending the letter with, please don't hesitate to contact me if you have any further queries. Yours sincerely, Nurse. I think it's clear, no?
Yeah, it's really clear now. And if anyone, can we see like if anyone is having any doubts regarding that?
Yeah. Okay, Abhishek and Sharon and some of them have asked like whether we can use STD. Okay, so two things I want to tell you. It's a usually globally used word. What is STD? Sexually transmitted disease. So we can. So it's a globally used word, so it's a accepted word. Okay, not used, it's an globally accepted word, so we can use STD. Now one more thing is that we have got word STD in the case note. If you want to see, you can just go back. We can see that STD is clearly given in the case note, so we can add that STD into our letter. So what do we need to look after, whether we need to add short forms? See, if it's a globally accepted one, we can use the word there, or we can use something that has given in the case note. It's completely fine. If you know the explanation, expansion, you can use it, or you can use the STD itself. See, STD and all, it's COPD, all those things are accepted ones, so we can use that. There is no problem in that. One more thing is there, ma'am, is it supposed to be a STD or an STD? So we can say it like ASTD. What do you think?
ASTD, right?
Yeah. Do you have? So I think we can use ASTD because it's not a vowel sound.
Yeah.
Okay. So we can simply use ASTD there. Okay, so I think all the doubts regarding this letter is over. If you have any doubts, please proceed to the comment section and you can ask fast. Okay, no problem in that. Your comments are always welcome.
Christy, we have got a doubt here, and is that mandatory to use capital letters while writing the medications?
I was expecting that comment actually, and I was waiting for it. Okay, so is that necessary to write medications in capital letters? So in the previous days, there was something like we need to write the generic names or some trait names in capital letters or small letters. So what I suggest is you can either use in two ways. Like you can either follow the thing that they have given in the case note, or you can do all the things like all the medicine names in capital letters itself. It's okay, no problem in that.
Okay.
So here I have used all the medicines names. So if you go to the last slide, you can see one more slide. So we have used all the medicine names in capital letters because we prefer to do so. That's why. Or you can follow the case note method. Okay.
I think following this will be more appreciable because there will be no confusion.
Yeah, don't you think like that? Yeah.
It's really
it will be easy for you to if you're writing in your exams also. Okay. So is there any other things?
Here we got a doubt from Minu. Is it necessary to put comma after contact me if you have any further queries?
Okay, can you please take that slide now? See, Minu, right? Yeah. Minu, if you are using, please do not hesitate to contact me if you have any queries. No need of any comma, okay? But if you are using, if you have any queries, comma, please don't hesitate to contact me. If you are using this one, no need of any commas. But if you are using, if you have that sentence starting, then there is no need of comma after the queries. If you have any queries, comma, please do not hesitate to contact me. Okay.
Okay.
I think it's clear, no? Okay. Right. Going further, I think we need to go to our next letter, right?
Yeah.
Okay.
Sure.
Shall we?
Yeah, we can proceed with that.
Now, what is the next letter's name?
Next patient name is Alan Marco.
Wow, that's an amazing letter. Yeah, I'm excited. Okay.
Can we proceed?
Of course. Okay, now here I would like to tell you regarding the relevant and irrelevant. Can I do with that?
Yeah, you can proceed with that.
Thank you. So here we have today's date. I'm going to select the relevant and irrelevant and semi-relevant letters right now itself. So please be there. Now today's date is 20 July 2019. That is relevant. Who are we? We are a registered nurse, and that is relevant. We are the registered nurse here, and we are working in a holiday resort that is in Bay Line Road, Auckland, New Zealand. Okay, we are a nurse at a holiday resort. That is relevant there. Now, patient details. His name is Mr. Alan Marco. Now, he is a 38-year-old man, and he is an accountant. Accountant thing is semi-relevant if he can add. There is no problem in adding while writing a social history. Now, New Zealand, he has accountant at Wellington Island in New Zealand, came for a holiday trip with his family for 2 weeks. So, what we have got here, he is an accountant, but still he is an accountant at where? Some other places. Okay, so this resort is in Auckland and he has came from Wellington Island. Both are in New Zealand but in different places. So obviously they came for a holiday trip and it's a new place.
Yeah.
Okay. You got an idea regarding that, right? Now he is with his family and he daily scuba diving, regularly swimming in the resort for the past 2 weeks. So see, from the past 2 weeks, so from here we have got that he is staying in the resort from the past 2 weeks and he has got increased activity, especially in water. Am I right? He has got a scuba diving and also he regularly swims. I think he loves swimming, right?
Yeah, from maybe that details we can understand that.
Yeah. Now, his diagnosis, okay? He has got a localized right external ear infection and uncontrolled blood sugar level. Is that necessary?
Yeah, I think it is really necessary.
Yeah, of course, we need to mention that in the intro para. So, localized right external ear infection, uncontrolled blood sugar level. Okay. Now, in the present complaints, Alan has severe earache for 5 days, assessed pain scale 4/10, blood sugar level unstable. Okay. Alan has severe earache for 5 days. I think that's relevant. Now, assessed pain scale, that's semi-relevant. I'm going to put a question mark there. Now, blood sugar level is unstable. Okay, so I think that is,
relevant.
of course, that's relevant. Now, 20 July. So, do you have any date in the previous slide? Yes, today's date is 20 July,
July.
and here also the date is 20 July.
July.
That means, what do you think? What does that mean?
Patient is presented.
Exactly, patient got presented today. Okay, so 20 July, what he has got on 20 July? He is telling that, that's subjective data. He is telling that he has right ear pain from the last 5 days. Okay, so it all started on when? Maybe on 15th July, but he hasn't approached any medical team. Now after the 5 days, he is coming. Now he has taken paracetamol, which is ineffective, and he has self-inserted cotton swabs to clean the ear. Now he flushed with water inside the ear also. That is also relevant. I think that's relevant, but if we go further, we can see some data contradictory to this. We can connect with them those.
Yeah.
So in the vitals, he has got normal temperature, pulse rate, normal everything, respiratory rate, and BP is normal. So why do we need to mention all those normal things?
I don't think it is really necessary to mention about the normal vitals.
So if you have an argument, you can simply add like his vitals were stable. Okay, or but I don't want to add those in my letters, but still for some of our students I will make it as a semi-relevant one, but for me it's a irrelevant. But still, if so, there are some students who really want to add vitals in every letters, so if you want, you can add like his vitals are stable, only that is needed. Now he has got right ear, and his right ear is hot while touching and tenderness on palpation, and his ear canal is swelling and reddened, and external ear is redness and without ear discharge. See, these are all what the objective data, that is during the examinations we have seen it. Okay, during the examination time we have seen these things. Now see, if we are mentioning all these things in a very expanded way, don't you think that it will be a little bit awkward or a little bit weird?
Yeah, first of all, it will be very difficult for the GP to read it and all thing about it. It will be a big story for him. Instead of that, we can cut short into in a concise manner.
I think we can show them in the writing letter. No? Okay, now we have got this thing here. Now his tympanic membrane is pale green color. That goes with the previous slide. Now, social history. So we are writing to a letter to a GP. We will see what kind of GP he is. Okay. In the social history, he has got type 1 DM. Now it is self-control and he is on insulin. Okay. That is very relevant. Yeah. Why is that? Because he has got an unstable blood sugar level, and we need to tell that he is a type 1 patient, type 1 DM patient, and the DM is self-controlled with insulin. We need to tell that. Okay. Now he has got cigarette smoking, 10 in a day, tried to quit but unsuccessful. So I think that that needs to be a hold there, because we will discuss that regarding why we are writing, and I don't think that that's really necessary, but we'll discuss why we doesn't need that. Okay, let it be in a hold there. Now diagnosis, localized diagnosis we have already written. Localized right external ear infection, otitis externa, increased water activity, unstable blood sugar level due to infection or increased physical activity. So here some of you might be asking, ma'am, there is a query before unstable blood sugar level. So does that mean that his blood sugar level is unstable? Of course no, because that query is for the causes. Like he has got unstable blood sugar level, that's confirmed, that's we have got on the previous slide that his diagnosis is that, but still see why he has got unstable blood sugar level, that's the query there. Okay, so he has maybe because of infection or maybe because of physical activity, so that's the reason why he has got a unstable blood sugar level. Okay, now in the localized right external ear infection, otitis externa, what do you think we need to write?
Maybe there will be higher chance for everyone to write like he's suspected to have otitis externa, but I don't think it is a good idea, because as we are nurses, we are not at all eligible to give a proper diagnosis. So we can write as he has localized right external ear infection. Is that right?
Exactly. I really love your explanation. Now one more thing is there. See, otitis externa, that's a diagnosis. Okay, who are we?
We are nurses.
We are nurses at a holiday
Holiday
resort.
resort.
So it's not our job to tell the diagnosis to a GP. Of course, so we can simply write his condition now. I think that's fine, no?
Yeah.
Okay. His treatment, yes. So his treatment, advised to take over-counter medication due to ineffectiveness of paracetamol, and that medicine is ibuprofen for mild pain. Now he is advised to refrain from cotton ball insertion and swimming. Okay, so obviously that's why I said earlier he is putting some cotton ball, or he is flushing his ear with waters. So we can connect with this thing here. His monitor blood sugar level regularly, increase insulin if high. So we need to mention the monitor, we need to monitor the blood sugar level regularly, and we need to increase the insulin, or sometimes they has already increased, but they are telling the GP that they have increased the insulin level because of highness. Okay, recommendations for the GP, why we are sending to the GP is clearly written here in this slide. Now recommendation is that consultation for formal diagnosis, review insulin therapy, now pain management for pain relief, and a call is made to a local GP to visit holiday resort to consult Mr. Alan Marco immediately. Here comes the star of the show. So who is the GP here?
GP is coming to visit him at the holiday clinic.
Yes, so it's a local GP at the place of this resort. Okay, and he is going to come to this resort to see the patient, and the patient name is Alan Marco. That's the only thing here. So do we need to write it like a visit letter? No, we can simply write it like a referral letter. Obviously we are referring, no? And we have got one more thing here, Mr. Alan Marco immediately. That means it's an immediate letter. Okay, still as it's an immediate letter also, we know it's an ear infection, or we know something that is related to it, and his symptoms are something that is not that much serious, so we can write it like it. You will see in our letters. I think it's clear to you. Can we have the writing task? Thank you. So in the writing task we can see write a letter to a local general practitioner, Dr. Cyril John, the Hayland Medical Clinic, Auckland, New Zealand. So the doctor is in the place of that resort. Now we are writing this letter to the general practitioner at that place.
Yeah.
Okay, so do you have any doubt in this?
No.
So would you like to explain, would you like to concise all these things to our students?
Yeah, so here we got a patient called Alan Marco, and he is on a holiday trip, and in New Zealand itself, and now he is having, and he do have a daily habit of swimming and increased physical activity, and after reaching the holiday trip resort, and his physical activity was increased, and he was having a severe earache and all, and so we are the nurse of that holiday resort, and so we are writing a letter to the local GP to come and visit him, to check on him and to provide accurate diagnosis measures, and also to provide a treatment plan for him. And other than that, he is having some other symptoms, like he is already a known case of type 1 diabetes mellitus, and he is on his diabetes mellitus was on control by using insulin, and now his sugar level is also increased, maybe because of this infection, and that's all about patient, right?
Exactly. So Sharon has asked, Mom, without knowing writing task, is it still possible to decide on relevant and irrelevant data? So Sharon, I really loved the question, that's why I read it out. Now, it is not easy to find out the relevant and irrelevant data without the writing task. We have already seen the writing task, that's why we have chose it. Okay, so in the previous sections on all, we have already clearly given an idea regarding how to read an OET letter, how to organize or how to transform an OET letter. So if you have gotten it out, you can just go to that live, or I can tell that right now also. So if you have got a case note like this, you can first read those things and then come to the writing task. That's the first method. Or you can just simply read the patient's name and age, then come to the writing task, then you can go to the details for finding out the relevant and irrelevant data. Okay, I hope you got it. Now So I think it's clear regarding how what is the case notice. Now I think we can move to the letter. Am I right?
Yeah.
Yes. So why don't you explain this?
Yeah, today's date is 20th of July 2019 and our recipient's name is Dr. Cyril John and his designation is General Practitioner and the address is the Highland Medical Clinic, Auckland, New Zealand. And that's all about the recipient details and his designation and all about his address. And next is salutation, that is Dear Dr. John. We always use the second name of the recipient, so we can write like Dear Dr. John. Next is reference, that is about our patient detail, Mr. Alan Marco, and he is age 38, so we can simply write as age 38.
Okay, I hope you got it. There is no doubt regarding. There is nothing to have any doubt in this address para. Now, moving to further. Okay, I think we have got a doubt in this Facebook. So, I think some of you have asked doubts regarding the Cassandra Kinzer here. I think we will discuss that in later. Now, if you have any doubts regarding Alan Marco right now, please ask in this comment section. That's fine. Or if it's Cassandra Kinzer's letter, we will discuss it at the end. Okay. Otherwise, we may lose this continuity. Okay, so moving further, in the intro para we have got an Alan Marco letter, and in the intro para I have used I'm writing to request an immediate consultation for Mr. Alan Marco to make a formal diagnosis of his condition. So I have used the word immediate consultation because I have got it in the case note. That's okay, no?
Christy, is that okay if we write instead of immediate and urgent or emergency? Is that okay?
That's a very good question actually, and of course we can write like urgent or emergency because that's somewhat synonym. But here we have got an immediate, that's why I have used it. But you can use urgent or emergency consultation in your letters. That's completely fine. There is no problem in that. Okay. So, I'm writing request an immediate consultation for Mr. Alan Marco to make a formal diagnosis of his condition. That is clearly given in the case note. That's why we have written like to make a formal diagnosis of his condition. That's the purpose of this letter. That's why we have said like that. Now, you will be asking whether we need to mention who requires here, right?
Yeah.
What if we can our purpose, if we can say our purpose in this way, then why there is a need to write that who requires particularly?
Yeah.
Do you think like that?
It's right.
Yes. So in the OET officials itself is telling that we need to make our letter in a very unique way. So it will be better if you could make in a unique way, and if you come out of those regular practice, I'm not telling that it's wrong, it's correct. Okay, it's completely correct. But still, if you try to make it in a unique way, it will be good. Okay. Now I'm writing to request an immediate consultation for Mr. Alan Marco to make a formal diagnosis of his condition. Now he has localized right external ear infection and unstable blood sugar level. Now before someone asked in the before session like whether we need to mention two things in the first body intro para. Yes, like at that time itself I have already told, but here also I want to tell you that it's not a diagnosis. Still we are telling that because both the things are extremely relevant in this case, because he has got some right ear infection and also he has got a unstable blood sugar level. Both those things are relevant. That's why we have asked like this. We have written like this. Now, localized right external ear infection. We haven't used the word otitis externa because we are a nurse. No doctor has seen the patient till now. So, we need to mention our way of writing or what we have got in the case note. So, try to mention those things in this form.
So,
okay.
Christy, you are telling like if you are not so sure about the diagnosis, it is better to avoid that diagnosis, right?
Yeah, it's better to avoid the diagnosis and to write those things in an expanded form.
Yeah.
Now, otitis externa is something a diagnosis. Don't you think like that?
Yeah.
During our nursing case notes and all, if we care plans and all, in the first pages, if we were writing some localized right external ear infections, the lecturers would have a big gross mark over there. Then they'll give us to change all those things. Do you remember, right? So we are nurses here in this OET letter. we need to mention our assumptions, our things, or if this patient has already seen a GP and the GP has got confirmed that he has got otitis externa, then it would have been completely fine. But in this case, we can simply write he has localized right external ear infection. That's okay. Okay.
Yeah.
I think it's clear. Now someone has asked, in reference we mentioned full name, so we can write second name in intro para. So I think you are asking about this one only, and so I clearly haven't got your question, but still I can explain it. The thing is that we need to mention the full name in the reference and also in the intro para. Okay, so intro para consists of 3 P's. Which are the 3 P's?
Full name.
Patient
Actually,
full name.
The introduction paragraph or the purpose paragraph consists of the full name of the patient,
Yeah.
and the reason or the purpose for
Yeah.
what we are writing, and also the type of letter, that is
Yeah.
whether it
And
is
also
a
the present
referral or-
conditions,
and
right?
also the current health status of the patient.
Yes, those are the 3 P's, that is patient full name, the purpose and present condition of the patient. Okay, so these things should be there in the intro para also,
Yeah.
right?
Yeah.
Yeah, okay. So can we move to the next? Before moving, what do you think the next para will be?
It will be regarding, because as this GP is not aware about Alan Marco, because this GP for this GP Alan Marco is a new patient, right?
Yeah, yeah.
So because he is on a holiday trip,
Yeah.
so it will be okay that if you are starting with about the initial background about
Yeah.
the patient, is that okay?
I really loved your explanation, Harsha. So shall we move to the next?
Yeah, sure.
Yeah. So like Harsha said, we are going like that itself. Mr. Marco is on holidays and is staying in the resort with his family.
Yeah.
As she has already said you, the patient has came to a new place and the GP doesn't have any idea regarding who this person is or why did he came here. We need to tell that, right? So that's why we have mentioned that line here. Now you will be asking here, like, as it's a urgent case, right? As it's
Yeah.
an urgent case, we need to mention the present thing first. See, I know it's an urgent case, but still it's not that much urgent. First thing. Second thing is that to have a clear idea regarding why this patient came here to the GP, we are mentioning those things here. Clear? Now, Mr. Marco is on holidays and is staying in the resort with his family. There is no doubt in that. He has been actively participating in swimming and water sports for the past 2 weeks. That we have already got in the case note. We need to tell that the doctor that he has been participating in those water-based activity. Now, today he presented with a 5-day history of right ear pain and symptoms of infection were evident on examination. So, Harsha, in the first Cassandra Kinser's letter, I told you we will tell something like this, no?
Yeah.
Yes, that is this. He presented with a 5-day history. So, if usually what we will do, we will write like he presented with the complaints of ear pain, symptoms of infection, ear pain and all those things from the last 5 days. Usually we write like that.
Yeah,
no?
it's a normal way of writing.
That's a very usual and very casual way, but try to write like this. Okay, it will be very good if you start writing your time period of the symptoms. Okay. Today he presented with a 5-day history of right ear pain and symptoms of infection were evident on examination. So in the examination thing we have clearly mentioned in the case note also that if we have got a lot of explanations or a lot of examination things, it's better if you could concise it. That's why we have said like this. Now, as paracetamol was ineffective, he was advised to take ibuprofen for pain. So he has taken a paracetamol but it was ineffective, so we said him to take ibuprofen. He was also instructed to refrain from swimming and cotton ball insertion. So all those things we have said in this first body para. Okay, now in the second body para we have got his
Past.
past and the social things here. Mr. Marco has type 1 DM which is controlled with insulin. Yes, that's right. It's controlled with insulin. His uncontrolled blood sugar levels may be due to infection or increased water activity. He has got an uncontrolled blood sugar level, but maybe that because of his increased water activity or infection. They are not telling that it's because of insulin. That's why we have mentioned that which is controlled by. it's still controlling, that's why we have mentioned like that. And he is recommended to monitor blood sugar levels regularly and to increase insulin levels accordingly. So if his blood sugar level is increasing, then we can he is instructed to increase his insulin levels accordingly. So I think that gives a clear idea.
Because it is given as it is in our case note, that if there is any fluctuation in the blood sugar level of the patient, you can adjust that insulin level too. So it is a direct one.
Exactly. There's nothing complicated in this. Now this is our last recommendation para. Your expert opinion and assessment would be beneficial for Mr. Marco to improve his condition. It is also important to review his insulin therapy and pain management. So we have said his review his insulin therapy and also about the pain management here. So I think it's clear there, and we have already mentioned that he needs to have some improvement. So it's the GP's opinion and assessment is necessary. I think it's a very small letter if you do it in a very concise way. Okay, so please don't hesitate to contact me if you have any queries. You are sincerely registered nurse. I think there is no objections in that, no?
No, it is really clear till that.
It's a very simple letter. It will be very beautiful if you could try to make in a very concise way and all. I think you have already got it. I think, and we have came to the end of this session. And so, do we have? If you have any doubts in regarding all these things, you can, or general writing, you can ask now. So, okay, Anjana, ma'am, while we write a single digit, shouldn't we add 0 before it? So, Anjana, I think I have said that already in the previous lives, Anna. If you're mentioning a date, so we need to mention that 0, because the date is obviously in DD, MM, year format. So we need to mention that 0 before it's single digit. If otherwise, it's completely normal. We usually write like that, no? So it's completely normal there. Okay. Okay, so do you have any doubts? Okay, Alka has asked, can we use the word patient in letter? Of course, I have said that in the first thing itself. Yes, we can use the word patient. Okay, no problem. Okay, so I think we are over with all the things. Okay, I think we have came to the end of the session, and I hope that it's clear. Both these letters are clear. So once again, I would like to tell you that if you got a very simple letter, try to make it in a very concise way. Okay, still it should have enough word count and all. So you can keep a model of these letters and make it in a very useful. You can use it in a very useful manner. Okay, so you have anything to tell them?
Nothing to say much, and best of luck to everyone, and yeah, that's it.
Yeah, thank you so much everyone for listening to us. But please stay tuned for our further updates and further lives. We have got lots of things for you, and I hope you all have a very good day, and I hope all the technical team working behind this, and I really thank all the crew in AJINORAH for having a very good sessions like this. So we all wishes you a very good day and very good weeks for the coming days. Thank you all.
Thank you so much.
Bye.
Bye.